Hello. My name is Dr. Francois Ricard. I am an osteopath and a PhD. I am director of the International Madrid School of Osteopathy, EOM, and president of the Scientific European Federation of Osteopaths, SEFO. In this video, I want to talk to you about physical examination in osteopathy, according to scientific literature. Part 2. Static palpation. The validity of static palpation of bone and muscle structures is a problem that affects physiotherapists, osteopaths, and chiropractors alike. The scientific literature indicates that there is a poor inter-examiner reliability in static palpation to detect positional asymmetries of vertebral bone structures, an important part for detecting the manipulable lesion, which all professions that use manual therapy have in common. We will review the literature on this topic, as well as possible solutions to improve static palpation. According to Fryer et al., 2005, the examiners who attended the training sessions for palpation of the pelvis achieved a marginal increase in the intra-exam and inter-exam reliability in static palpation. As always indicated, these clinical tests for the pelvis should be reconsidered due to their non-established validity and low reliability among examiners. The study by Degenhardt, 2005, indicates that during the initial assessment of inter-observer reliability, the kappa ranged from -0.02 to 0.34, within the reliability range of poor to fair result. In Degenhardt's study, after consensus training, reliability improved by increasing at the moderate range for changes in tissue texture, kappa equals 0.45, to the substantial range for pain assessments, kappa equals 0.68. The reliability of positional asymmetry improved, kappa equals 0.34. The authors concluded that consensus training improved the inter-observer reliability of common osteopathic palpatory tests of the lumbar spine. In 2 of the 4 tests which were studied, tissue texture and sensitivity, acceptable kappa values were achieved for clinical tests after consensus training. The study by Kim et al., 2007, sought the reliability of inter-examiner palpation for the pelvis. It was significantly higher for the level of the posterior superior iliac spine than for the iliac crest, p less than 0.05. The vertebral levels at the level of the spis identified by palpation ranged from the L5-S1 space to the S2 spinous process, and the vertebral levels at the level of the iliac crest varied from the L2-3 space to the L5 spinous process. Knita and Lucas, 2008, studied the reliability of intra- and inter-examiner palpation to identify asymmetry of anatomical landmarks indicative of pelvic somatic dysfunction. The most reliable palpation was found for the measurement of the position of the inferolateral angles of the sacrum, the ossus, and the medial malleolus. The reliability of physical examination for anatomic landmarks indicative of pelvic somatic dysfunction was generally found to be low. Hanneline et al., 2009, indicate that the reported agreement indices are generally low in palpation of the spine and sacroiliac joints. There are no significant differences between palpation methods. No type of static palpation can be considered superior. Stovall et al., 2010, when studying the reliability of the palpatory evaluation for asymmetry in the lumbar spine and pelvis, indicate that it is insufficient, but that the studies are of heterogeneous quality. More research is needed to better understand the reliability of asymmetry assessment methods in manipulative medicine. Snyder et al., 2011, in their study on the ability to locate bone landmarks by palpation, indicate that examiners identified a spinous process in 91% of vertebral assessments. Correct identification of the vertebral level occurred in 69% of the time. Accuracy depended on the experience of the examiner, the presence of anatomical abnormalities, and the body fat index. Sutton et al. 2013. Placing a hidden 5 mm heel wedge to alter the height of the spine showed poor inter-examiner reliability in detecting posterior superior iliac spine asymmetries. It indicates that osteopathic education needs to be reviewed. Cooperstein and Hickey, 2016, also indicate that current palpation methods for posterior superior iliac spine asymmetry have insufficient inter-examiner reliability, and that improved methods should be sought. Cooperstein et al. 2017 indicate that, during manual palpation, the examiner's fingers touch the soft tissues covering the iliac crests, generally determining the level of the spine L3-L4, rather than the L4-L5 level as presumed. According to Bain et al. 2018, static palpation is moderately reliable in general. Bain et al. 2018 indicate that, if static palpation was moderately reliable overall, however, greater agreement was found within the mid-thoracic spine. First conclusion. Diagnostic palpation of the pelvis is the most problematic. But overall, inter-rater reliability is poor, and much worse than intra-rater reliability. It is likely that the methodology used to carry out these studies needs to be improved. It may not be the most appropriate. The choice of examiners is not the best. It is necessary that each examiner has received identical training. Otherwise, it is unlikely that the results will be adequate. Second conclusion. It is interesting to note that in studies using an adapted training system, such as OTSU in Kirksville, the inter-examination reliability of students in osteopathy is greatly increased. It is advisable to use the OTSU model for learning static palpation in manual therapy. It seems clear that the teaching methods for palpation of bone asymmetries need to be improved. The OTSU teaching model is as follows. Snyder et al. 2014 used a covered and uncovered transverse process wood block and transverse process models of a lumbar spine to simulate a range of positional asymmetries of the transverse processes. For the uncovered wooden transverse process block model, Assessment 1, students correctly identified the direction of asymmetry with a probability 0.89 for 1 mm skew, 80% threshold, 0.94 for 2 mm, 90% threshold, 0.95 for 3 mm, 95% threshold. For the covered wooden transverse process block model, students correctly identified the direction of asymmetry with 0.80 probability for 1 mm, 80% threshold, 0.92 probability at 2 mm, 90% threshold, 0.98 probability at 3 mm, 95%. For the uncovered transverse process model of the lumbar spine, students correctly identified the direction of asymmetry with a probability of 0.93 to 2 mm, thresholds of 80% and 90%, 0.95 to 3 mm, threshold of 95%. For the covered lumbar spine model, students correctly identified the direction of asymmetry with a probability of 0.87 to 4 mm, threshold 80%. Conclusions on static palpation. Do not forget that static palpation is not the main diagnosis, and that it relies on a set of three elements. Pain provocation test. Static palpation. Dynamic palpation, mobility tests. Neither can the inspection of the patient and the orthopedic tests that are part of the detection of osteopathic mechanical dysfunctions be ignored. The quality of the studies is highly variable. There are biases. The problem of the palpation technique used arises, which varies from one study to another. For palpation of the bony landmarks of the pelvis, the Fred Mitchell-Dew methodology is recommended. Training protocols for static palpation should be improved, particularly in physiotherapy. The training methodology proposed by Snyder et al. 2014 seems highly effective. Here we have the references of the scientific articles used in this conference. Thank you for listening.